After studying this module, you shall be able to know stimulant drugs and their classification, some notable stimulants and their signs and symptoms, mechanism of action of stimulants, forensic analysis of stimulant drugs. Stimulants, which are often referred as psychostimulants, are psychoactive drugs that temporarily induce improvements in either mental or physical functions or both. The effects that stimulants generally exert may include enhanced alertness, wakefulness, and locomotion. Due to their rendering a characteristic up feeling, stimulants are also occasionally referred to as uppers. Stimulants have a marked contrast to that of depressants or downers, which decrease mental or physical function or both. So both of these are considered to be functionally opposite. Stimulants are widely used throughout the world as prescription medicines and even without prescription, both as legal and illicit substances. As stimulants speed up mental and physical processes in the body, they can be useful in the treatment of certain medical conditions. But this property of certain drugs also makes them attractive to recreational drug users. These medications have many adverse side effects, and there is a high potential for addiction associated with the risk of destroying their mental and physical health. Central nervous system stimulants speed up the operation of the brain and spinal cord. It is important to emphasize that speed up does not mean improve or enhance. The central nervous system stimulants definitely do not make the brain work better. Rather, they cause the brain and the rest of the nervous system to work harder and often to make more mistakes. The speeding up caused by central nervous system stimulants results in significantly increased heartbeat, respiration, and blood pressure, all of which can lead to physical harm to the abuser. In addition, the stimulant user experiences nervousness, irritability, and an inability to concentrate or think clearly. Mechanism of action. The exact mechanism of action of a stimulant depends upon the type of drug. These drugs are sometimes referred to as feel-good chemicals because they can induce a feeling of euphoria. Generally, the stimulants like amphetamine, cocaine, and methamphetamine work by increasing the levels of a neurotransmitter known as dopamine. Stimulants enhance the effects of these chemicals in the brain. These chemicals are able to stimulate the brain. The associated increase in dopamine can induce a feeling of euphoria when stimulants are taken in over-medically approved dose. Some of the other stimulants increase up the levels of some other chemicals like serotonin and norepinephrine. Stimulants also increase blood pressure and heart rate, constrict blood vessels, increase blood glucose, and open up breathing passages. Notable stimulants. First, amphetamine. Amphetamine is a potent central nervous system stimulant which is often used in the treatment of attention deficit hyperactivity disorder, that is ADHD, and narcolepsy. Amphetamine was discovered in 1887 and exists in the form of two enantiomers, levoamphetamine and dextroamphetamine, having both of them in equal proportion. Medically, amphetamine is generally used as a performance and cognitive enhancer, and recreationally as a euphoriant. Although it is a prescription medicine, still unauthorized possession and distribution of amphetamine is often rigidly controlled due to the significant health risks associated with uncontrolled usage. As a consequence, amphetamine is illegally synthesized, trafficked, and sold by chemists clandestinely. Benzedrine was the first pharmaceutical amphetamine that was used to treat a variety of conditions. As the dextroisomer was a more potent stimulant, Benzedrine was gradually discontinued in the favor of formulations chiefly containing D-amphetamine. As therapeutic doses, it causes emotional and cognitive effects such as euphoria, increased arousal and improved cognitive control. Likewise, it induces physical effects such as decreased reaction time, increased muscular strength, resulting in fatigue resistance. On the contrary, much larger doses of amphetamine are likely to impair cognitive function and induce rapid muscle breakdown. Addiction is yet another serious problem associated with amphetamine abuse. Very high doses can result in a psychosis, as recreational doses are generally much larger than prescribed therapeutic doses. Recreational use carries a far greater risk of serious side effects. Amphetamines have a number of legitimate medical applications, including control of narcolepsy, control of certain hyperactive behavioral disorders in children, relief or prevention of fatigue to allow persons to perform essential tasks of long duration, treatment of mild depression, control of appetite, prevention and treatment of surgical shock, treatment of Parkinson's disease, maintenance of blood pressure during surgery, enhancement of the action of certain analgesic drugs, and to antagonize the effects of depressant drugs. Second is caffeine. Caffeine is a central nervous system stimulant. It is one of the most popular drugs in the world, consumed by up to 90% of people in the world in one form or the other, but mostly in beverages. Caffeine is the most commonly used mood-altering drug in the world. Coffee is extracted from the beans of Coffea arabica and contains mainly caffeine. Caffeine is the world's most widely used stimulant that belongs to class xanthine, a compound which is found naturally in coffee, tea, and to a lesser quantity in cocoa. Caffeine is said to be the most widely used of all mind-altering substances in the world. Today, caffeine is consumed not only in the form of coffee but also as chocolates, cocoa drinks, cola drinks, and tea. Apart from its use as a stimulant, caffeine is also used in combination with various analgesics to increase their potency. Several common pharmaceutical preparations contain varying concentrations of caffeine. It is included in many soft drinks as well as a larger amount in energy drinks. Caffeine is also included in some medications for enhancing the effect of the primary ingredient or reducing one of its side effects, especially drowsiness. Caffeine use can be associated with several distinct psychiatric syndromes: caffeine intoxication, caffeine withdrawal, caffeine dependence, caffeine-induced sleep disorder, and caffeine-induced anxiety disorder. Next is ephedrine. Ephedrine is a sympathomimetic amine similar in molecular structure to the well-known neurotransmitter epinephrine or adrenaline. Ephedrine is commonly used as a stimulant, appetite suppressant, concentration aid and decongestant, and to treat hypotension associated with anesthesia. In chemical terms, it is an alkaloid with a phenylethylamine skeleton found in various plants in the genus Ephedra. It works mainly by increasing the activity of norepinephrine or noradrenaline. It is most usually marketed as the hydrochloride or sulfate salt. Next is methamphetamine. Methamphetamine is a neurotoxin and potent psychostimulant that is used to treat attention deficit hyperactivity disorder, ADHD, and obesity. Methamphetamine exists as two enantiomers, dextrorotatory and levorotatory. Dextromethamphetamine is a strong central nervous system stimulant than levomethamphetamine. However, both are addictive and produce the same toxicity symptoms at high doses. Although rarely prescribed due to potential risks, methamphetamine hydrochloride is approved by the United States Food and Drug Administration under the trade name Desoxyn. Recreationally, methamphetamine is used to increase sexual desire, lift the mood and increase energy, allowing some users to engage in sexual activity continuously for several days. In low doses, methamphetamine can cause an elevated mood and increased alertness, concentration and energy in fatigued individuals. At higher doses, it can induce psychosis, which may lead to cerebral hemorrhage. Methamphetamine is known to have a high potential for abuse and addiction. Recreational use of methamphetamine may result in psychosis or lead to post-withdrawal syndrome, a withdrawal syndrome that can persist for months beyond the typical withdrawal period. Unlike amphetamine and cocaine, methamphetamine is neurotoxic to humans, damaging both dopamine and serotonin neurons in the central nervous system. Entirely opposite to the long-term use of amphetamine, there is evidence that methamphetamine causes brain damage from long-term use in humans. This damage includes adverse changes in brain structure and function, such as reductions in gray matter, volume in several brain regions, and adverse changes in markers of metabolic integrity. Next is nicotine. Nicotine is widely used throughout the world for its stimulating and relaxing effects. Nicotine is the active chemical constituent in tobacco, which is available in many forms, including cigarettes, chewing tobacco, cigars, and smoking cessation aids such as nicotine gum, electronic cigarettes, etc. Nicotine is a colorless to pale yellow, very hygroscopic, oily liquid with an unpleasant pungent odor and sharp, burning, persistent taste. It gradually becomes brown on exposure to air or light. Nicotine is a stimulant of the central nervous system and is abused widely all over the world in the form of inhalation, like cigarette, cigar, pipe, bidi, nasal inhalation, like snuffing, or chewing. Nicotine is also used as an insecticide. Nicotine induces pleasure and reduces stress and anxiety. Smokers use it to modulate levels of arousal and to control mood. Paradoxically, while nicotine is a stimulant drug, effects of both stimulation and relaxation may be felt. The mental and physical state of the smoker and the situation in which smoking occurs can influence the way in which a particular cigarette will affect psychological perceptions. The addictive effect of nicotine is linked to its capacity to trigger the release of dopamine, a chemical in the brain that is associated with feelings of pleasure. Next is cocaine. Cocaine is also a powerful stimulant that produces similar effects as that of amphetamines, namely increased alertness accompanied by suppression of hunger and fatigue. It is generally sniffed and is absorbed into the body by the mucous membrane of the nose. One other form of cocaine which is quite popular is crack. It is manufactured by heating the mixture of cocaine, baking soda and water. It is also snorted and produces similar effects like cocaine. Next are medicinal usage. Stimulants are used therapeutically for treatment of a number of indications like to counteract lethargy and fatigue throughout the day, in treating attention deficit hyperactivity disorder, that is ADHD, to counteract fatigue and maintain alertness for extended periods and critical operations in military aviation and space flight, to reduce sleepiness, to decrease appetite and promote weight loss, for treating clinical depression, to relieve nasal congestion and to treat orthostatic hypotension, to relieve headache in part by potentiating other drugs like caffeine, to aid in smoking cessation like nicotine. Next is abuse. Abuse of stimulants is very common. Such drugs are commonly used for recreational purposes. People are attracted to the stimulant's ability to increase energy levels. Stimulants enhance the activity of the central and peripheral nervous system. Addiction to some central nervous system stimulants can quickly lead to medical, psychiatric and psychosocial deterioration. Stimulants, particularly the amphetamines, have a high potential for abuse. Individuals with a history of alcohol and substance abuse may be at risk for abusing stimulants. Individuals who abuse stimulants develop tolerance and psychological dependence that may result in addiction. With long-term abuse of stimulants and the resulting sleepless nights, the individual may develop psychotic symptoms. Stimulants may increase blood pressure. Individuals with a history of high blood pressure or heart disease should be cautious about taking stimulants because these agents can exacerbate these conditions. Uncontrolled high blood pressure can have serious consequences including stroke and heart attacks. Patients taking stimulants should routinely check their blood pressure. Individuals with a history of seizure disorder should be cautious while taking stimulants because these agents can lower the seizure threshold. Common effects of stimulants may include increased alertness, improved attention, less need of sleep, increased heart rate, elevated mood and euphoria, improved concentration, loss of inhibitions, increased confidence, increased respiratory rate, decreased drowsiness and fatigue, increased energy levels. Stimulants historically were used to treat certain respiratory and neurological disorders, but as their potential for abuse and addiction became apparent, the medical use of stimulants started to be misused. Use of stimulants may result in the reduced amount of production of natural body chemicals that perform similar functions. The come down from these stimulants tend to be so harsh that the substance abuser may feel the need to keep on taking more so as to reclaim the good feelings. Crack cocaine is a particular addictive central nervous system stimulant, as the high only lasts a few minutes. It results in an urge of continued usage in the user. Next is signs and symptoms. Stimulants produce a wide range of different kinds of effects by enhancing the activity of the central and peripheral nervous systems. Many stimulants are also capable of improving mood and relieving anxiety, and some can even induce feelings of euphoria. However, dose of a stimulant that is taken is the key that regulates the effects produced by that stimulant. First, acute intoxication, euphoria, increased motor activity, increased speech activity, increased wakefulness and suppression of appetite. In case of chronic intoxication, sleep problem, loss of appetite, mood swings, amphetamine psychosis, rapid and irregular heartbeat. The severity of acute amphetamine and methylphenidate overdose depends on the amount ingested. An individual may experience a progression of the following symptoms from an acute overdose: restlessness, agitation, irritability, insomnia, hyperactivity, confusion, elevated blood pressure, rapid heart rate, delirium, hallucinations, irregular heartbeat, convulsions, coma, circulatory collapse, and death. Next is withdrawal symptoms. As with other drugs of abuse, it is possible for individuals to become dependent upon or addicted to stimulants. The withdrawal symptoms from this type of drug may be unpleasant, but they will usually pass after a short period of time. The real problem for people in early recovery is that they can feel like to be flat without these substances. However, such symptoms include no major physiological disruptions, disturbed sleep, moderate to severe depression, and extreme fatigue. Next is forensic analysis. The presence of stimulants in the blood may be tested by a variety of procedures. Serum and urine are the common sources of testing material. Preliminary screening by color tests, chromatography, immunologic assay, and mass spectrometry are the common techniques employed in such analysis. We'll end this module with summary. Stimulants, which are often referred as psychostimulants, are psychoactive drugs that temporarily induce improvements in either mental or physical functions or both. Due to their rendering a characteristic up feeling, stimulants are also occasionally referred to as uppers. Generally, the stimulants like amphetamine, cocaine, and methamphetamine work by increasing the levels of a neurotransmitter known as dopamine. Stimulants enhance the effects of these chemicals in the brain. The effects that stimulants generally exert may include enhanced alertness, wakefulness, and locomotion. Stimulants are used therapeutically for treatment of a number of indications like to counteract lethargy and fatigue throughout the day, in treating attention deficit hyperactivity disorder, etc. Abuse of stimulants is very common. Such drugs are commonly used for recreational purposes. People are attracted to the stimulant's ability to increase energy levels. Caffeine can have negative effects on pregnant women or on women who would like to become pregnant, including an increased risk for difficult conception and miscarriage. Caffeine is transmitted through the placenta and through breast milk to the baby.